Hi everyone. Today I'm explaining movement principles and clinical benefits to optimize your everyday movement. The deadlift involves a series of movements from the arms down to the feet to lift a barbell off the ground. However, let's remember that the mechanics from this movement extends far beyond the weight room. Deadlifting applies to lifting anything off the floor, from the sofa to your child. So before you get into any technical components of deadlifting, keep these 2 points in mind: your distance to the object and your foot stance. Our center of mass is in our pelvic region. The distance between our pelvis and the object can dictate the difficulty level of that lift. The shorter the distance between our pelvis and the object means it can be easier for our bodies to move the object. To be efficient and therefore effective with your lifting, position yourself so that the object you want to lift is close to your pelvis. When it comes to foot stance, understanding how foot stance impacts your lifting is important so that you can change your stance according to the task at hand and based on what your specific strengths are. The deadlift exercise, along with its variations, is performed with the feet lined up. By lifting a weight or object with the feet lined up, you are relying on your back and hips to execute the lift more than the lower extremity. If you are using a staggered stance when lifting objects, that is, you're hinging at the hips and bending at the knees, this recruits more of your leg strength and may ease the work on your back. Lift smart and efficiently. For example, if you are recovering from a back injury and have to do some lifting tasks around the house, it may be best to use a staggered foot stance whenever possible, since that involves your legs more in the lift. For those of you who lift repetitively, whether it's at work or in your workout routine, keep in mind these signs that may indicate ineffective lifting mechanics. Pain. This is the most common sign people look for, but there are other signs to also consider. Lower extremity symptoms. This can include pins and needles, tingling or numbness, persistent one-sided muscle soreness or cramping, whether at the back, hips, or lower down. I hope you found these general tips helpful. For more insights specific to your case, please don't hesitate to reach out to me here at the Movement Clinic.